Welcome, everybody, to May's Ohio Health Modernization webinar for the month of May. I just said that. And I am Adam Riley. I'm with Caracol, the AIDS Service Organization for the Cincinnati area. I'm their prevention manager. And I'm also with the Ohio Health Modernization on the steering committee and the communications subcommittee. So today's presentation, I'll be introducing our speakers here in just a minute, but before we do that, we are offering continuing education credits. If you would like those credits, make sure you fill out the survey. The link will be put in the chat towards the end, and that will allow you to get the CEUs. If you do want CEUs, please make sure you put your name and your license number in the evaluation. That makes it easier on our end. If you have any questions today that come up after the webinar, we're going to ask you to reach out to Kim Welter with the Ohio Equality Ohio. She'll put her email in the chat here in a minute, and we'll get you connected with the speakers that way. But if you have questions during the webinar, please put those in the chat or the Q&A section. We'll be monitoring those. And just to let you know, our June webinar is going to be faith and stigma. And then we have a July webinar that's going to be youth and HIV criminalization. And for today's topic, which we're very excited about, we have two presenters, Evan Millward and Bryan Jones. Bryan Jones has been thriving with HIV/AIDS for over 34 years, and has been an advocate activist for most of that time. He is a national founding member of the International Undetectable Equals Untransmittable campaign, the U equals U campaign. He's also a voting member in the Cleveland Planning Council and the Ryan White Regional Advisory Group. He's presented nationally on mass incarceration, housing instability, HIV, and U equals U. Mr. Jones was instrumental in the formation of the Ohio Modernization Movement, whose mission is to modernize the HIV non-disclosure laws in Ohio. And he's also involved with the Zero Project and a lot of other efforts, both in Ohio and nationally. And then Evan has been an anchor reporter for WCPO 9 News in Cincinnati since 2014, with an emphasis on underreported communities and enterprise storytelling. He is well into his second decade as a journalist. Past experiences include work with the KMIZ in Columbus. You might have to explain what that is, Evan, in Columbus, Missouri, and the Columbus Dispatch, as well as the Dayton Daily News. He is a member of the National Lesbian Gay Journalist Association and the Society of Professional Journalists. So I'd like to thank both of them for being here today. And just so you know, we had a lot of people register for today, a little bit more than we usually do. So at some point towards the middle of the presentation, a poll is going to pop up asking you how you heard about this webinar. So if you can fill that out, it'll just inform us for future webinars. So with that, I am going to go ahead and let Bryan and Evan take it away. And thank you.
I guess I get to go first. I'm Evan Millward with WCPO 9 in Cincinnati. Adam, thank you for that introduction. KMIZ is just a TV station. They're the ABC and Fox affiliates in Columbia, Missouri. It was my first real TV job out of college. I'm excited. I just met Bryan yesterday, and you're in for a real treat. I'm so happy to know him now. He's very funny, but first you have to get through me. And I'm going to kind of lay a foundation, I think, for a little bit about how, in general, news outlets operate. I know this is a question more often than not these days we get, and we'll talk a little bit about trust in media later, but as trust in the media or in news has declined, it's good for us to pull back the curtain a little bit on how we do what we do, because it's not probably nearly as complicated as a lot of people think it is. We'll talk about what is news first. So generally speaking, what is news? And everyone has kind of a different definition of it. The one I like to use is news is is the unexpected, but that's really just part of it. I put a handful on the screen here. News, first of all, is something that is new. It's recent, or it's been newly discovered. It was previously undiscovered. It's something that's unusual or unexpected. That's really what I lean in on. It needs to be interesting or significant, but most of all, and I think foundationally, news is about people. Our best stories, the stories that we like to tell the most, certainly that I like to tell the most, are really about the human spirit. And that is sometimes good, sometimes bad. I always tell people that I tend to see people on either the absolute best day of their life or the absolute worst. And there's not much in between for that. So that can be a little bit of a challenge. Some other factors that go into determining, is this news? Proximity. Obviously, we are a locally owned in Cincinnati. We're owned by the UW Scripps Company. They're based here. We own about 60 television stations all across the country. We're an ABC affiliate. So ABC Network, we tend to let handle national and international news, and we can take that from them. We pay them. So we get some access to their stuff. We are focused on our communities. So we cover about 30 counties-ish in 3 states here, Indiana, Kentucky, and Ohio. But proximity for us drives what is news. And then this has become sort of a buzzword, but broad impact. We like to ask, so how many people will care about this story? How many people does this affect in determining what is news? I love this a lot. What is news? We always say a dog bites man may not be news, but a man biting a dog is definitely news. It's unexpected, and it is significant. So where does the news find the news? And we get this question a lot. Like, so how do you determine what you put in a newscast every night? Or what goes on your website? And it's a whole bunch of sources. So ideally, right, we hire journalists, and journalists develop sources and develop relationships with people in the community, people in power, and our neighbors. And these people tell us things, and we listen to them. We also have this wealth of information that can be mined from going to or listening to open meetings. Anything the government is doing that affects you should be open, and states have different laws about it, but that should be done in the public. And so you can listen to it, I can listen to it, and we can report off that. A good example is last night, Cincinnati Public Schools superintendent announced she's stepping down in June, and it happened at a public meeting. We got tipped off that it was coming, so we were there. And that's big news for the largest district in our area and one of the largest in the state of Ohio. Public records, same thing. A lot of information is available. You just have to ask for it, and you have to know what to ask for. Court filings in Hamilton County, where Cincinnati is, they're online. Government documents, a lot of them are online, but a lot of things you have to dig for. And so there's a request process. Sometimes it costs money, sometimes it doesn't. Sometimes we have to sue the government to get information that we know exists, but they don't want to give us. And then, of course, you get press releases, people who work in public relations. I sort of have my folks who, they kind of know what stories I like to tell, and they'll call me when they have one that fits that mold. I troll social media all day for stories, because that has become sort of the water cooler and the neighborhood gossip these days, and you can learn a lot by what people post online, but you always have to check it. And then basic curiosity does it as well. An example of that is they were building a downtown Kroger, big deal in Cincinnati, next to Kroger headquarters, and I drove by it every day, and I was like, they have a 300-foot tower crane that's building this and pouring all the concrete. I'm like, who works up there? And it turned into one of my favorite stories I've ever told. So a day at WCPO 9, this is sort of how things operate. As reporters, we pitch stories all the time. There's not like a designated time to pitch a story. We have an online form we fill out. Our focus recently, in particular in the last few years, has really been on enterprise reporting, finding stories no one else is covering, and doing less what we call commodity news, which is a house fire, a car crash, a shooting, the things that we're going to go to and cover, but maybe don't get the full reporter treatment because everyone's doing them. The morning show, those producers get in at midnight. They have a 3:30 meeting with the anchors and the reporters to figure out what they're doing. And that repeats itself for each shift. So at 9:30, the folks who work during the day show up. At 3:30, the people who work for the 11 o'clock news show up and talk about what they're doing. What are we already working on? What do we need to go do? What are the stories you've pitched? So we have done a lot, and I'll talk about this a little bit later, about openness with how we cover our stories. And my boss, Mike Cannon, has posted a number of times as a column about, here are some of our discussions and how we decide how we're covering news and what news we are covering. And when you're ready, one of the things I liked that I wanted to show you from that column that was written when Richard Spencer was scheduled to come speak at UC's campus, and we had said, here's how our thought process on how we are or are not going to cover a white supremacist speaking on campus. And I like this: on any given day, there are hundreds of possible stories. We choose the ones we think are most important or most interesting to our community, and then we cover the ones that we have the resources to cover. Budgets are what they are. You all get that. So we have a finite number of resources, and we try and do the best with what we've got. And then this was, how do you decide what information goes into a story? I always say this is the hardest part of my job as a reporter, or even as an anchor, is you gather all these interviews and you get all this information, and I have a minute and 30 seconds to put everything on TV. Luckily, the internet is infinite, right? And so I can do much more depth online, but in a minute 30 on television, it sounds like a long time. It's really not. And so we kind of have to use our best judgment. And my boss sort of outlines this in that column there. And so you can see that on your screen. We might talk to 5-8 people and only use 3 of them in a story because maybe they're the most emotional sound or the best interviews or the most relevant information. And we can use information that someone else told us on background to help drive who else we need to talk to. So some other factors here in determining what becomes a story and what makes it onto television or onto our website, for TV especially, is there compelling video or audio? We're a visual and audio medium. If you watch TV, the most compelling thing you see on TV is the really wild video, right? So we put an emphasis on that, and the story is, okay, is the interview really good? Is the video really good? And if the video is not great, that maybe won't be the first thing you see in the newscast. I talked about broad impact a little bit. This has been something that's been big for us the past few years at WCPO, is what impacts a lot of people who would be watching us, and how can we tell that story and make people care about it and realize anything. And then the next ones are a couple of things that I like to say, especially on the weekend. So I'm the weekend anchor, and I like to say every one of my newscasts, I want to teach someone something. I want to make them feel some way. So I want someone to watch our 30 minutes at 6 or 11 on Saturday or Sunday, and I want them to turn the TV off after and be like, you know what? I didn't know that. I learned something. And then if I can get you to laugh and I can get you to maybe cry, if I can do all 3 in one newscast, it's a home run for me. At the end of the day, it's about people, and it's not just telling stories about people, but it's about the people who are, I want to impact people. I want you to feel something. I want to feel something as I'm reporting the story. And then obviously we have time constraints, our deadlines, we're in at 9:30, we're on the air at 4. Can I get this told accurately in those few hours? And if I can't, then maybe can we push it and get some more time or work our way around it? And then that is sort of my basis of where we come from and how we do news. I want to turn it over to Bryan Jones now to kind of carry on the next section of this presentation, Bryan.
Well, thank you very much, Evan. I just looked at my watch and I see that I'd like to do an update. I have been thriving with AIDS going into my 38th year. And we do this work so long that the information constantly changes. So I can't believe it sometimes myself. But Evan said a few things that really sparked something in me. He said news should be about people, as it should be. But when it comes to HIV and AIDS and reporting, and this is the reason for this webinar, it's not about the people. It's not about the human side of it. It's solely about HIV. He had a shocking headline that said, "Man bites dog." But if that was, it would say man with HIV bites dog, and they would be more concerned if the dog contracted HIV. And that's no shame on Peter, because I have a little dog named Diva Pearl. But it just goes to show you that the human side of people living with HIV has never been taken into account. And so we, through this webinar, hope to disseminate some of the myths, dispel some of the myths, and possibly bring a more level playing field as it comes to relating to people living with HIV and AIDS, because we are people living with HIV and AIDS in this day and age. I'm going to talk to you about the Stigma Index. And it's important for those who disseminate news, either formally or informally, because for me, we all are disseminators of news. Anytime you have a conversation with someone, you should walk away or should work to educate or gain education from that person. So as we look at people who do it formally, it's important to familiarize yourself with aspects of the Stigma Index, because the Stigma Index, and I'll explain to you what that is, it humanizes who we are as people living with HIV. Also, besides the Stigma Index, I also want to point out that it is important to bring yourself up to date on the latest science, such as U equals U, which is undetectable equals untransmittable. It says that a person who is living with HIV and who is on effective treatment cannot transmit HIV to their sexual partners. It's not possibly has a good chance. The science is clear. You cannot transmit HIV to your sexual partners. So the Stigma Index was first launched in 2008 globally. And it is the largest social research project of its kind. It was implemented, developed, and carried out by people living with HIV and AIDS. To date, it has been utilized in over 100 countries, and over 100,000 people living with HIV have taken the survey. The most important part about this is 1,600 people living with HIV and AIDS were trained to do the actual, to implement this actual survey. So stigma, as many of us know, is one of the biggest barriers that still face people to this day. But there's stigma in everything. There's stigma in being too tall, too short, too light, too dark, too black, too white. There is stigma everywhere, but the stigma surrounding HIV and AIDS is insurmountable. And it shows up not just in the HIV sector, but it shows up in all the other intersections. So if you look at Black people and people of color, we're compounded with several other stigmas that we have to fight through, not just HIV and AIDS. Now, the Stigma Index was rolled out by the international community of women living with HIV, the United Nations through a joint project, the global community of people living with HIV, and one more. Oh, the International Planned Parenthood. So these 4 organizations grounded the study, but the information was developed, the data was gathered and put into a format that could be used to implement initiatives and actions through the MAP organization, the MAP Center of Urban Health Solutions, which tackles difficult health problems in urban and sometimes rural communities. Now, there were several strategic approaches. I'm going to just read this one thing. In addition to data documentation, the Stigma Index project implemented various initiatives to promote effective responses to the HIV stigma and discrimination in the states. Now, currently, in 2013, when the Stigma Index came to the United States, specifically, I'm going to talk about Michigan. This was in 2013. They outlined 5 priority spaces, priority initiative areas in which they wanted to cover. The first one was faith-based. The second was HIV criminalization, internalized stigma, transgender justice, and youth justice. I'm going to say that again. They concentrated on 5 initiative areas. the faith-based, HIV criminalization laws, internalized stigma, transgender justice, and youth justice. These were very important, and you'll be surprised. I think it's important for those of us who do disseminate this, the news. It's important to familiarize yourself with the stigma index, because like I said, it brings a humanistic approach and it brings a greater understanding of how we should do reporting. Like I said, it was implemented in over 100 countries. Over 100,000 people have actually taken the actual survey. Now, as it relates to Michigan, they had two projected goals. One was to document the experiences of internalized social and institutional stigma and discrimination among people living with HIV. The second one was to increase the capacity of people living with HIV and the allies to effectively challenge HIV stigma and discrimination. And those people who are in the media space, we consider you allies. And so in order to be an effective ally, we must exchange education so that we educate each other, so that you can approach reporting of the story and you will understand what I mean by approaching it from a racial equity lens, which I'll talk about later, and also implicit biases. So these were another areas. There were other areas that they worked to, through the Stigma Index. It helped to increase capacity building and equity promotion, and it gave people the tools in which to build up a community. There's a movement called MIPA, meaningful involvement or greater involvement of people living with HIV. So the Stigma Index allows people and allies to see ways in which they can understand that our lived experiences is just as equally important as someone's book experience. Well, while he's talking about it, as we who disseminate news, those who disseminate the news are the gatekeepers of our lives. What I mean by that is those who disseminate formal news control the narrative of our lives. And a perfect example of the HIV and AIDS epidemic, in 1981, when the story first broke in the New York Times, the title said, "Rare Cancer Seen in 41 Homosexuals." By reading this story, they talked about 41 gay white men who had contracted this rare gay cancer. But the CDC and those health organizations failed to mention the fact that during that 12-month calendar year, that 86 Black people had contracted that same strange cancer. But the news that was covered in 81 only mentioned 41 white homosexuals, which gave the impression to people, Black people and white women, that they were safe, that HIV and AIDS was not something that they needed to be worried about. But by 83, the CDC and health outlets, news outlets, didn't start recording our numbers until 1983. And even then, the mistake that was made, the CDC made, was they only counted those people who had progressed to these strange opportunistic infections, but they didn't count the numbers of people who tested positive for antibodies. Even though there was not a formal HIV test, they still knew people who had other opportunistic infections that could have put them in that category. When they finally decided to release the numbers of the Black population, the floodgates had opened. The news had the capacity, and those who disseminate the news had the capacity at that time to change the focus of HIV and AIDS. And I think it might have changed the landscape of where we are today, of Black people and people of color being most impacted, because we're most impacted by everything. And we're often left out of the narrative that is being perpetuated by news sources and news outlets. And talking about a racial equity lens, like I said, is something that I will talk about later. But to end on this, the Stigma Index, just to give you a little piece of the Stigma Index. One example is that when asked, one of the questions people were asked, do you think that for fear of being prosecuted, that you should delay care or not be in care. Now, 49% of the people said that it was not reasonable to delay care, but 51% said it was reasonable and very reasonable to delay care, meaning that these criminalization laws are contrary to what they were set out to do. They're bad public health policy, and it keeps people who are living with HIV from seeking treatment. It keeps the environment, it makes the environment, doesn't make the environment safe. And news should educate people and give them confidence in whatever they're trying to disseminate. It shouldn't make people live in fear. And a lot of times, misinformation or lack of information, such as not including U equals U, undetectable equals untransmittable, into our recording and our reporting, it can make people feel more secure and take away some of the stigma. Another thing is, there was another statistic, and I had it somewhere on here, but I'm not gonna worry about it right now. 60% of the people felt that they would not be given a fair trial if they had to go to trial. If someone said that they didn't disclose, that they were a sexual partner of theirs and they didn't disclose, 60% of the people who were screened felt that they would not be given a fair trial. Now, we can look at that as the overarching 60%. Now, Black folks, compounding that by our own stigma as relates to the justice system, and understanding that stigma does exist for being Black in America. So I think I'm going to pass it back over to Evan. Hopefully I covered what I thought I was going to do, but Evan, it's on you.
It's a good transition, Bryan, too, because I want to talk a little bit about trust in media and pretty much how we've gotten it wrong a lot for a long time. This is kind of where I just take shots on ourselves, on the industry here. If you want to go to the next slide, trust in media is broken, as I think everyone knows at this point. This should not be new to anyone. Edelman recently did a survey that showed only 46% of people have any semblance of trust in traditional media. That's the lowest it's ever been. Some other research firms have shown much lower than that, and varying degrees, right? A lot of trust, some trust, take your pick, it's bad. So one of the things we've been doing, the EW Scripps Company and WCPO 9 have, for the past 2 to 3 years, kind of been on a journey, and maybe even a little bit longer, have been on a little bit of a journey to figure out ways to rebuild trust and stop doing some of the problematic things that we've done. I'm going to show you some of that here in a little bit, and then how this correlates to HIV and the Stigma Index. We are part of what's called the Trusting News Project, and it is run out of the University of Missouri. And it basically is looking at best practices and trying to aggregate. We're throwing everything at the wall to see what sticks. But what we've somewhat broken down into is a number of strategies here. On your screen, you'll see we need to do better at showing our work and how we work and explaining our process. We need to invite feedback, and that means criticism, and that means questions, and then we have to answer it. And we need to be a little bit more customer service focused on this. So the Trusting News Project there, what it is trying to do is conduct a lot of research and then provide training for newsrooms and support as we're kind of on this journey to build out this best practices. And that ranges everything from, we've gone in and tested headlines different ways. We've reported stories, and in a focus group, we show the story that aired, and then we, based on some of the research that's done that people want to see, whether it's informational graphics on the screen or changing how we approach something, we can change just by shifting some of the language in a story. And when you show both stories to a focus group, and they're almost always going to pick the one that's Trusting News approved. So here's one of our examples. Again, my boss writes a lot on our website about our process to try and pull back the curtain. And trust me, sometimes this blows up in our face a little bit. This is kind of one of those examples. This is something that you're seeing a lot of newsrooms start doing, an example of things that everyone did in news because everyone had always done in news. And we realized that we are creating stigma by doing this. And frankly, we're not being fair to people. We no longer show mugshots with crime stories, with a handful of exceptions. Those exceptions are if someone's on the run and police are looking for that person, if they believe there are more victims of this person and they want those victims to come forward. And then if there's a conviction, we will show their face, but generally at that point, it's not a mugshot, it's them in court. But here's what happens is you're seeing a mugshot of someone accused of a crime, as my boss writes there. They've not had a good last few hours. They might be intoxicated. They're probably upset. And if you believe in the justice system in this country, they're innocent until proven guilty. And when we show a mugshot, in a way, we are convicting them. We spend a lot of time talking about writing to not convict people. But then you turn around and you show their mugshot as if, the banner can say accused of, but you're showing their face, and that follows them, especially in the digital age where this lives online forever. This is not a corporate policy with us yet, but a lot of our stations in our company and our station group are doing this. You're seeing a lot of newspapers get rid of that mugshot gallery that people used to have. That's one example of what has kind of come out of this. And so this is what, as we've been looking at the Trusting News Project and looking at some of the things we're doing, we are going back and reevaluating these codes of ethics. And these exist, and these are going to build a foundation for maybe what we need to do better still on other topics moving forward. So the EW Scripps Company, our code of ethics is broken down into those 6 categories: honesty, accuracy, fairness, minimize harm, acting independently, and obeying the law. And they mimic the Society of Professional Journalists, which is the largest journalist organization in the country. It's sort of the industry standard. Its code of ethics has been around for decades. It has been updated a couple of times, including recently, but it breaks down to something very similar. Seek truth and report it, minimize harm, act independently, be accountable and transparent. What's one of the big ones that shows up twice there? It's minimize harm. And so we talk about, how does HIV coverage fit in? You just heard Bryan talk about it, about how we can be allies and we should be making people feel secure and safe and not feel scared by educating them here, especially when it comes to stigma here. So minimizing harm is a principle, but are we practicing it? In a lot of ways, we still are not. And I think if you watched any local newscast, particularly if you watch a national newscast, you're going to point out a couple of examples. You're like, well, I don't know. And I'm going to show you a couple here in a second of things that just made me go, oh, I don't know if I like that. We are in many ways perpetuating widespread misconceptions about things when we don't minimize harm, when we don't take the extra step to seek out accuracy in this. And there is a need for more and better education of journalists, particularly when it comes to HIV science and issues and stigma and then coverage. And you're seeing a lot of change in this industry in the last couple of years, where we've been hearing from people for years that they feel like local news in particular is important and it's crucial. And I'll briefly tell this story. Our company did a focus group a number of years back where they sent all of our managers into homes of folks all across the community. And this was particularly focused on the Black community. And they spent a whole day with these families, just talking to them, learning about everything that they might deal with, learning about who they are, where they grew up. But at the end, they were talking about news coverage. And one of the questions asked was, what would happen if there was no local news? And one of the women, and this one took everyone's breath away. One of the women in one of the families thought about it for a second and said, I don't know, things might be better. And what we've learned is that, and to Bryan's point again, particularly in the Black community, they're the most engaged news viewers, but it's largely because they feel the most wronged, or and not even that they feel, they have been the most wronged, or that there's something that is impactful there, but maybe not in the right kind of impactful way. Here's two examples, not from our station. I literally just was Googling HIV Cincinnati, and I looked in the news tab and I was reading some stories, and here are two that popped up to me as like, boy, that feels to me, even as a reporter, feels problematic. The first one deals with someone who was taken into custody. While they were at the hospital, they threw a bottle of urine at a sheriff's deputy. Court documents said they immediately had to take an HIV test. That doesn't appear to be something that, just because the court documents say it, I don't know that it's worth reporting. What was the point? There's no context for it. And that continues to go on to stigma. Look, we were talking about this before the webinar started. Throwing a bottle of urine at a sheriff's deputy is its own crime. It's harassment with a bodily fluid, regardless of HIV status. The second one is, quotes the Ohio health modernization movement, but it comes out of nowhere. This is a story that it is recent. It's a former police officer charged with rape. And then several months later, it turns out the prosecutor came out and said he just tested positive for HIV. So while I appreciate that this outlet reached out to the Ohio health modernization movement, that one, they didn't get the name right. Two, there's no context for this. So it's a nice gesture, but it didn't quite get it across the finish line. Clearly, we still have work to do on this. And again, not us. But so there are some resources for journalists, and I want to arm you with them as well. So if anyone has a question, the Associated Press has a style guide. It's industry standard. It explains terms and language and what you should and should not say. If you want to drill down deeper, the National Lesbian Gay Journalists Association, NLGJA, not only has a style book, and I've screenshotted there the part on HIV/AIDS, and it further breaks things down too. It's pretty comprehensive, discussing coverage and language. It also has resources. They have resources on their website. I'm a member of this organization. I've been to their conferences. I have the style book in my bag at all times and a second one at my desk. I've made it a Slack response in our newsroom. So I didn't make a Slack response in our newsroom. One of our managers did. But so it's there for us. I think more newsrooms probably need to do this. And then this is one I stumbled upon not long ago. HIV Plus magazine with NLGJA also has a style guide. It was built out in 2015. It's pretty comprehensive. I couldn't get a good screenshot of it, so I just put a link there, but it's HIV Plus magazine, or it's through NLGJA too. Very focused on HIV. So if you see an issue in news, absolutely say something. I would like to think a lot of the issues come from ignorance, and that I would like to think my colleagues want to know and want to fix it. So if you see something, don't be afraid to say something, offer to fix it, and be a future resource. That is a great tool in that journalist toolbox, and we love to fill our toolboxes with phone numbers and people and resources, even if it's just like, hey, I'm writing this story, I need to know how to appropriately phrase this. But if you have an issue, who should you talk to? I'm a big believer in chain of command. If you have an issue with my story, please come to me about it, because I'm probably going to go, oh boy, I didn't think about that. I'm an idiot. I didn't know any better. Let me fix it. If the reporter doesn't want to hear it, then you should go to the manager or the editor or the news director who's kind of in charge of that newsroom and say, look, I've tried to bring this up. This is an issue. Here's why it's an issue. And they can do it. And if there's still nothing from there, you go to the top. That's the general manager, the publisher, whatever, and you just have to take the top. And if you're still having problems, then you start talking to community groups about this. But most journalists I know want to hear when we've slipped up, especially when it was something we didn't intend to. We're just ignorant. We don't know it. And so I always want you to come to me and be like, hey, that ain't right. But sometimes you're going to run into a reporter who's just not going to listen to you because they exist. Next slide, and I think I get to turn it over to Bryan and hand off on some of these issues that you see in news.
Okay, a few things.
Evan,
thanks,
Bryan. Sorry, we've got a
okay.
couple of questions that I wanted to see if we could get answered real quick.
Sure.
So the first one, someone wrote in the Q&A, in the situation where the media did not include HIV cases in Black people in the original 1981 story, did the media choose not to report it, or did the CDC fail to disclose it? Sometimes the media are only conduits of official sources that spin the news the way that they want it to appear.
That is absolutely correct. It filtered from the CDC, that's why in recent years we see more investigative reporting. I don't think back then that the investigative reporting dug deep enough. I don't think they pressed deep enough. All we saw in the media, and even if you look at ACT UP footage, all you see are white gay men or white lesbians, but Black people were definitely at the forefront of this fight. But if you look at the footage, you would think that only white people were engaged in the fight. A big campaign that stemmed out of it was, women don't get AIDS, they just die from it. Because women were not looked upon as risk, but women were dying in amazing numbers because of the opportunistic infections that the CDC chose to list as being AIDS diagnosis didn't include cancer of the uterus, which women contracted in alarming numbers as a result of the HIV. So, right, but I feel like we're responsible. Like you said, when something's wrong, we have to ask questions. We've got to hold our CDC and these health organizations accountable. What would make them think that it was a condition that only white people got? I mean, we have sex too, right? If we all here because someone had unprotected sex. So,
yeah, and to that end, you're right. We're only as good as our sources. I always like to say, and for a long time, media and in many ways still today, media is still a lot of news outlets, particularly, God help you if something happens in a small town where they just don't have a lot of staff because station groups aren't going to pay a lot of people and pay them well to work there. They don't have the staff to do that. They really are taking a press release and turning around and maybe asking one or two questions, and that's it. And to Bryan's point, there is a big push in the last handful of years to do more in-depth reporting. We know that's what people want. It's what people tell us they want. So we're trying to do more of it. It takes time. It takes money. It does not move quickly because we have to cross all of our T's and dot all of our I's as traditional media. But I was talking about this exact topic to a friend of mine this weekend when the new season of Pose started, and she's a reporter in New York City. And she posted, she's like, I actually am so angry and upset that this story has to be told now so much later when no journalists of note at a national level were telling the story of HIV/AIDS when it was happening. And with a couple of exceptions of a couple local reporters in San Francisco, truly no one was telling the story, and they weren't telling it accurately. And so my friend who works in New York was like, I hate that we're relying on FX to accurately portray this story all these years later. And she goes, that makes me, as a journalist, it makes me angry. And it's just one of those things where we're like, I can't excuse it, right?
So, Adam, in light of time, I'm going to push forward.
Yeah.
But if you can read the question, and I may be able to incorporate it into this next spiel that I have. But if you can go ahead and read the question and then allow me to go forward and then catch it on the back end if I don't cover it.
Okay. The one that we have right now is in regards to the story about the prisoner throwing urine on a guard. can you comment on whether it would be appropriate to add in that story the fact that HIV cannot be acquired from urine? In other words, the story could be an opportunity to educate the public about a law that is contrary to science.
Okay. Well, I think educating the public is one thing, but educating our judicial system and those who work in corrections and rehabilitation, like Evan stated earlier, the crime itself has a prosecution platform already. The fact that HIV has nothing, you can't contract HIV in that way, does not make the story more relevant. It only sensationalizes the story because people have HIV. You can talk about a man steals a pack of hamburger from a supermarket. It'll be a man with HIV steals hamburger. What do the two have to do with each other? But HIV will be the leading headline. So I'm going to push forward. I had a little piece of paper here. Evan talked about, I keep calling Adam Evan. Evan talked about mugshots, and then he mentioned some exceptions. Unfortunately, the exceptions that you mentioned are the norm when it comes to HIV and AIDS stories. People living with HIV are considered to be on the run. They're considered to be dangerous. They're considered to be infectious. They're considered to do all those things that you mentioned as reasons as you wouldn't air your mugshots. But the law enforcement and those powers that be would press you to air those mugshots. Then he talked about the code of ethics, honesty, and those other things. A person only knows what they know. Those code of ethics and how they're carried out looks different in whatever part or pocket of the country or the world that you live in. And I want to give a shout out to Dominique for taking you on this journey of a racial equity lens. It was something that I'd heard of, but I never thought of delving into. But the more I learn about it, and I implore anyone who does any type of reporting to start understanding what the racial equity lens is and looking at things and looking at their own implicit biases. Now, reporting should educate and strive to be objective as opposed to subjective. And that's why it's important for those of us who do any type of reporting or work in a service-related industry or at aid service organizations or nonprofits, that to address it from a racial equity lens. A thing about addressing it from a racial equity lens is saying that understanding that when it comes to HIV criminalization laws, that Black people and people of color's experiences with our justice system and our lived experiences are vastly different than our white counterparts. And we've got to take that into account. We've got to think about access to care, the judicial system, mass incarceration is real for us. And in order for you to look at it through a racial equity lens, you first as individuals must address your own implicit biases. Now, implicit biases are biases that we have, and it's sometimes unconscious to us that we have these biases. But implicit biases, we develop these by all the information that we take in throughout our lifetime. Many times, people unconsciously may think that a Black man and robbery or drugs go hand in hand. Not because you're racist or prejudiced by any means, it's because of the information that you've been filtered and the narrative that you have been given through the various media outlets. And a lot of times you say, Evan said that you're only as good as your sources. Well, sometimes them implicit biases act out as a source, and you may not realize it. And it may not just be your implicit biases, but it might just be small implicit biases of everyone who sits on the news staff. So as my little bias here, another department's little biases here, by the time the organization is represented on the air or in publication, all those biases may show up. So another thing is I want to talk about, and I know we are short on time. Let me see what the time says. I want to talk about people language first, because language does matter. Language controls our narrative. Evan said that he had managers go to their house to watch the news. It's funny. Many times other demographics watch the news for education or to be kept up to speed. Black people watch the news to survive. We watch the news not to die. And a lot of times we've got to translate what the news means into what it really means for me as a Black person. Because people will say, oh, well, it won't impact you. But trust and believe when they say, well, I've always learned to not believe someone who says, trust me. Because if I could trust you, you would need to say, trust me. So people language first. We're not HIV positive. We're people living with HIV. We don't have a disease. We contracted a virus. We're not infected. We contracted HIV, transmitted HIV, however, but we want to stay away from that word transmitted because with U equals U, undetectable equals untransmittable, you cannot transmit HIV if you're on effective treatment. And we need to start using the media in a way in which an ally would. And that's not saying that media's the current situation, some of them are. But like Evan said, a lot of it is just ignorance of information. And we've got to understand that using U equals U, the stigma index, and other important information as ways to argue that Black people and people of color and those most impacted by HIV and AIDS need access to treatment. Another thing as it relates to criminalization laws, is some of our implicit biases shows up because we think that just because someone tells you you have an HIV diagnosis, that you understand what that means. The stigma index stated that many people who get tested, the following year get tested again. Why? Because they're in denial and don't believe the test result that they got the first time. So as we look at it through a racial equity lens, we understand that Black people have a valid argument when it comes to medical mistrust because of the track record that we have been dealt throughout history. And then compacted by the fact that if we're most impacted by HIV and AIDS, we stand to be most impacted by HIV criminalization laws. So this preferred language to address stigma and discrimination is very good. We also think that we use the word disclosure. The law talks about disclosure, but disclosure in itself is a stigmatizing word. Disclosure says to give new or secret information. It's up to us to share your status because it's yours to share. Disclosure and HIV should not be a secret. I think I pretty much covered it all. And lack of time, I'm going to say thank you and pass it back over to whoever gets the football.
Thanks for that.
Did I not have my video on that whole time?
Your video's off right now, but you had your video on.
Okay.
So I wonder if we have any questions that people might have. We went through a couple. And if you want to put those in the chat, or if Evan or Bryan, if you have anything based on some of the questions that were asked before that you wanted to make sure you got across.
Francesca asked a question in the chat that I think was really interesting about reporting U equals U, and particularly about reporting heterosexual people can contract HIV, transgender folks. We don't do enough is the answer. Truly, we've done a little bit. We, at least at our shop, a couple of, 3 or 4 years ago, I profiled a study happening at UC through the College of Medicine that was looking at, that was sort of early PrEP trials, and actually going into it, I was like, oh, this is a really interesting story. And as we talked to one of the subjects of the story, he was telling me about stigma, and the story shifted a little bit to be about stigma, and it was, they were having trouble getting participants in the study because of the stigma around it. But we don't do enough, particularly about U equals U. I mean, I literally had a friend of mine the other day, not understand that HIV was not a death sentence and hadn't been for decades. And I was like, oh, And this was a moment of realization I had, right? So I would say we haven't done enough, but I thought that was a really good question. Thank you.
And you say, it's funny you mentioned that HIV is not a death sentence, but for many Black people and people of color, it still is. And it's not a death sentence because of HIV on itself. It's the structural and systemic disparities that exist, lack of access to care. COVID-19 should further bring home the point that what we're experiencing now with Black folks and people of color when it comes to COVID-19, we experienced years ago with HIV and AIDS. And I want to add, we have resources. You posted a lot of resources, but people living with HIV and AIDS are our most valuable resource. I have a PhD in HIV and AIDS. After thriving with it for 38 years, if I don't have something to say, something is wrong with this picture. And we must start putting our lived experiences into news reporting and putting validation. And why should I have to ask permission to be a part of your news when I am the news? When we are people living with HIV, we are the news that needs to be perpetuated, not something that you read in a report. We have lived experiences that are just and even more valuable. So we've got to change the narrative and change the culture of what we value when it comes to news.
I agree 100%. News is about people. And if
Hallelujah.
I don't have you, what's the point?
Well, you just said that, so the next time you reach out to do a story, I look forward to you contacting me.
You know I will.
But pay me. That's
See,
another
that I
thing.
can't do.
People with lived experiences should be paid for our expertise, just like a doctor or anyone else that you solicit information from. Sometimes you don't feel that you have to do a little payola here and there, but our experiences are valuable.
I will tell you, I am not allowed to pay anyone. Someone could have the best video of my life.
Well, you can interview me over dinner at the steakhouse.
All right. Well, thank you both for this discussion. We are coming up right on 1 o'clock. This was great for anybody who attended. If you want to see the recording, it'll be on the OHMM website. And Kim just put the link to the survey for continuing education credits in the chat, so be sure to fill that out if that's what you're seeking. If you had any questions that couldn't be answered or we weren't able to get to, be sure to email Kim, which her email is in the chat as well, and we'll get the answers to you that way. Again, everybody, thank you for joining us. Bryan, I always love seeing you present. Evan, thank you for joining us. This was great.
Thank you.